Ask the Doctor with Michael Lange begins in 2 minutes. Ask the Doctor with Michael Lange begins in 60 seconds. Ask the Doctor with Michael Lange begins in 30 seconds. Ask the Doctor with Michael Lange begins in 10 seconds.
When it comes to your health, are you seeing the check engine light come on more than normal? It's time to get under the hood. It's time for Ask the Doctor with Dr. Michael Lange. Sponsored by Lange Eye Institute and Fortify Vitamins. Dr. Lange is a board-certified optometric physician and certified nutrition specialist, helping people see and feel better through proper nutrition for 25 years. The doctor is in. Call now with your questions at 877-969-8600. That's 877-969-8600. Here's your host, Dr. Michael Lange.
Okay, good morning and welcome to Ask the Doctor. I'm your host, Dr. Michael Lange of the Lange Eye Institute and Fortify Vitamins, here each and every Saturday morning live to answer any and all questions you may have regarding your vision and eye care. So take advantage of this hour, pick up the phones, give me a call. Live call-in number is 1-877-969-8600. That's 1-877-969-8600. It's a little bit nippy here in the Tampa Bay area this morning. It's about 50 degrees coming across the bay, but it's going to be a beautiful day. It's going to warm up probably to about 80 degrees out on the beach today. So I recommend everybody get out doing some grounding, all right? Getting some vitamin D from the sun, a little exercise. What a great way to start the weekend. If you're new to the program, who's Dr. Lange? Well, I'm a board-certified optometric physician. I'm a certified nutritional specialist. I founded Lange Eye Care and Associates March 15th of 1993, and the Lange Eye Institute about 10 years after that. Also the founder of Fortify Vitamins. And this show is dedicated to you, the listener. I've been hosting Ask the Doctor since April of 1993. Almost 30 years. And we talk about nutrition for your eyes and your entire body. We talk about nutritional anti-aging, all right? I'm involved in a lot of clinical studies and research and development of supplements for total body health. You can learn more about what we're into at fortify.com. That's Fortifie, fortify.com, Fortifie, fortify.com. Also, the Fortify headquarters are located in Ocala, Florida. Dr. Richard Hall heads that up. We've got a large 2-story building on State Road 200. That's 3101 State Road 200. Also, that's where the Lange Nutrition Center hails from. And of course, Doc Hall is there Monday through Friday. for nutritional evaluations and consultations and talk and chat. And you can buy all your vitamins if you're in Ocala or any in that area at the Lange Nutrition Center. Also, the Fortified Nutrition Center is in Clearwater, right here on McMullen Booth Road in the Publix Plaza. That's the Bayside Bridge Plaza. And I'll be there today about 12:30 for a couple of hours, 12:30 to 2:30, sometimes till 3, talking about nutrition and anti-aging and showing you what we've developed, and also oftentimes giving you samples of protein drinks and gummies and all sorts of cool stuff. So come on by if you want to talk to me personally at the Fortify Nutrition Center today from about 12:30 to 2:30, maybe 3 o'clock. All right, I'm going to introduce my co-host, Dr. Richard Hall, the infamous icon in the nutrition sports world. Doc Hall, what do we have on our agenda this morning? And good morning.
Good morning, Dr. Lange, and a happy Saturday to our listeners. I guess I'm cold and I can't talk. Yeah, I have to get my mouth working here. And happy Saturday to our listeners and our viewers. We're glad you're with us on this chilly Saturday here in Florida. Just before airtime, I checked local temperature, and Ocala still is sitting at 35 degrees. Now, I know for some of you folks up north who are having 0 temps right now and wind chill factors of below, that doesn't seem like a big deal. But for us here in Florida, that's major. And but as Dr. Lange said, by noontime, it'll be 70, 80 degrees, and we're right back to being in Florida. So, don't worry about us. We'll be okay. We have a huge show planned today. Dr. Lange has some very important information and updates on macular degeneration and also on some dry eye issues. And I have some new advice on sarcopenia. Both very important information for you. So I hope you get that extra cup of coffee or hot tea this morning, sit back and listen to our show. I think you'll learn some things and maybe something that you need. And we're always here for you, and at the stores and the locations, and of course on the radio. So sit back and back to you, Dr. Lange.
All right. Thanks, Dr. Hall. And yes, we will be talking about macular degeneration and some clinical studies that I have looked at for years and years in the development of Fortify Macular Defense and the reasoning why I've changed Fortify Macular Defense 14 times. I'm working on the 15th revision now. So we're going to talk about the proof. The proof is in the pudding, why I put the Fortify Macular Defense formula together with the nutrients that are in it based on a lot of good clinical studies. It's an evidence-based supplement. We're also going to talk about sarcopenia. Dr. Hall had mentioned sarcopenia is muscle wasting. And as we get older, as we mature and we start aging from birth, we can start losing muscle mass, especially at 50, 60, 70, 80 years of age. And that's not necessary. If you do some of the things that Dr. Hall and I are going to talk about, eat some of the foods and take the right supplements, you can stop sarcopenia and muscle wasting and actually build muscle until you have 2 feet in the grave. All right, we're going to go to the phones. Let's see. Everybody knows who's first. It's usually Bob. He gets up pretty early to call to be first. Bob, good morning. Welcome to the program.
Good morning, doctors. Good morning. It's a pleasure to talk to you this Saturday morning. Like Dr. Hall said, it's a bit nippy here in Ocala, a little bit of frost on the pumpkins this morning. I have a concern and a question for you doctors. I have a pastor friend up in snow country, up in Indiana. He's a few years my senior, but he has almost a phobia about drinking water, and he's got some issues, medical issues. He's fighting some cancers, had cancer surgery and other things of that nature. But last week, he was almost incoherent when I talked with him, and later conversation with his wife, she ended up taking him to the doctors, and they gave him a bag of fluid. He was extremely dehydrated. Now, like I said, he almost has a phobia about it. Everybody around him that loves him, cares for him, constantly encouraging him to drink 50% of his body weight and in water a day, and he might get 8 ounces down, and that's under duress. What are the ramifications of, I'm going to call it winter dehydration? I mean, obviously during the summer in Florida, dehydration is a big deal because of the heat. But what about in, where you're not perspiring like that? Is dehydration? Now, I know the answer to this. Is dehydration still a problem?
Yes, absolutely. It's a problem no matter if it's hot or cold. Just talking, respiratory droplets come out of your mouth. When we're doing this talk show, I've got a bottle of water in front of me. I drink during the show because I can get dehydrated. Dehydration is a root cause of many emergency room visits, as you well know. And dehydration is a root cause of many, many health problems. I mean, just to mention a few, heart arrhythmias like atrial fibrillation. Ultimately, you can stroke out and die from that. Brain fog, cognitive decline, dry eyes. I mean, joint problems, skin problems, organ failure. There's so many different things that can be caused by dehydration. And a lot of people just do not drink enough fluids. Having a bottled water is easy because you can have those little 8-ounce bottles of water and just open one and drink one every couple of hours. And as a rule of thumb, you need to drink half your body weight in ounces of water. But also, many people need to drink more than that. Many people wake up in the morning, have 2 to 3 cups of coffee, and then they have 2 to 3 glasses of wine or a cocktail in the evening, and they're drinking iced tea or tea during the day. And these act as diuretics, and it causes you to become even further dehydrated, yet you're thinking you're getting plenty of fluids. A lot of people are consuming way too much sodium, also salt, and they're out sweating, or they're talking a lot. So there's a lot of things that, that can cause you to become dehydrated. There's gobs of medications that people are taking that can cause you to be dehydrated as well. So as a rule of thumb, half your body weight in ounces of water, and many people need to drink much more water than that. The ramifications can be quite serious, as you know. So people that aren't going to drink a lot of fluids, they should eat some fruit and vegetables. I mean, vegetables have fluids in it, but watermelon, a lot of fluid in it, okay? Oranges, blueberries, strawberries. So that's fluid, and it has electrolytes, and it has, all the vitamins and minerals in it as well. But many of the people listening to the show are indeed dehydrated, so we got to consider drinking more water, each and every one of us. As a matter of fact, I'm going to open this up, and I'm going to drink some water while Doc Hall chimes in.
Absolutely. The problem with not consuming enough water, and I see both extremes of this, honestly, every day. I see people walk into the store or walk into my office, and they're carrying a gallon jug of water. And I'm thinking, and as you're trying to have a conversation with them, they're hoisting up this big gallon jug and taking a sip out of it. And I'm thinking, like, it can't be that bad, where you have to haul around a big container of water like that. A bottle of water like that, that's fine. Or I see the other extremes, as Bob was saying, where people just don't consume any water, and you're kind of fooled. And you mentioned this, Dr. Lange, that well, I'm drinking some wine, or I'm having some beers, or I had a couple of good friends that they worked outside all day and they consumed tons of diet sodas, and they said, well, doc, that's water in there. But as you alluded to, Dr. Lange, that's also a diuretic because of the caffeine that's in there. So you have to be real careful with that. Same thing with coffee. Coffee is a natural diuretic. And so you're actually losing more water. And you made a very good point, too. You don't have to be super active or sweating that you can see it on your skin. We're all giving up moisture and water as we sit. And so we have to replenish that, folks. And it's very easy. There's little tricks you can do. Set your water out on the counter in a bottle and make sure by the end of the day that you've consumed that. And, it's so important. It's not one of those things that, well, I'm just a little bit dehydrated, so no big deal. No, it is a big deal. I mean, as Dr. Lange said, you can trigger so many things in the body just by not drinking enough water. And one of the big issues, too, is brain fog. You just, you can't focus, you can't think straight, you can't concentrate. And well, that's a sign of getting older or this or that. No, it's not. You need to drink some water. And that's the thing you need to do. So, Bob, what I would suggest, is try to get your friend, into some good spring water and like that. And, try to, you have to talk him into the good part of drinking water. That's the thing, to convince him how necessary it is for his body to consume that much water. And I really wouldn't talk to him about ounces and things like that, because that can be a little bit overwhelming when you talk to people about, how many ounces they have to drink a day. And some people just like, I'm never going to do that. But let their caregiver know that, hey, he needs to drink 60, 80 ounces a day, and make sure that you reach that level. And that will help. I mean, and the good thing about rehydration, okay, is it's almost immediate. If you have this brain fog and things that is caused by dehydration, drink some water, and within, honestly, minutes, things start to reverse themselves. So it's not something that, it's going to take days.
And also, a lot of people listening are drinking way too much alcohol and too much coffee. And remember, too much alcohol and too much coffee not only causes dehydration, but it causes high blood pressure, hypertension. And a good portion of our population that's listening to this program has hypertension, which is, once again, the root cause of many of these other health issues. So it's a vicious cycle. So drink more water. All right, Bob?
Well, gentlemen, he tells me after he's had his surgery and coming out of rehab, he had a lot of difficulty being able to move by himself. I mean, he's now in a walker, but first thing he said to me was, if I drink that much water, I can't get to the bathroom that many times. So, that ends up being an excuse, although valid as it may be, it's still a deterrent from him doing what he really needs to do.
Right. And Bob, he needs to talk to his physician about that, because there are certain medications that can help him eliminate the amount of urination, how often he has to get up, and that's better than being catheterized. But there are definitely medications that he can take. There's even supplements that he can take. Douglas Laboratories makes one. Life Extensions makes a really good one that can help decrease the amount of urination as well. So that's an excuse. There's ways around that. But he's going to die if he's dehydrated for a chronic period of time. Simple as that.
That's what I wanted to hear right there.
All right, Bob. Thanks for the call.
Thank you, gentlemen.
Thank you.
Talk to you next week, brother.
All right. We're getting ready to go to the next call. You're listening to Ask the Doctors. I'm Dr. Michael Lange and Dr. Richard Hall here to answer any questions we have. We'll try to answer them to the best of our ability. We oftentimes don't know the answers, believe it or not, and we'll do the research and get back with you. Phone lines are open, 1-877-969-8600, 1-877-969-8600. The topic of conversation is going to be macular degeneration today. Go to our website, fortify.com. Check out the macular defense and the zinc-free macular defense, the advanced retina formula. Check out those. Read the information and the studies underneath them. That will enlighten you on what we're talking about. All right, let's go back to the phones. Raymond has been waiting very patiently in St. Pete. Raymond, thanks for holding, my friend.
Yeah, thank you. Well, my question is about the macular defense that you were talking about.
Mm-hmm.
And could you comment on the AREDS2 formula in terms of does macular defense have the equivalent of what's in the AREDS2 formula?
Right. So the AREDS2 is a big study that showed that 500 milligrams of vitamin C, 400 units of vitamin E, 80 milligrams of zinc, 2 milligrams of copper, 10 milligrams of lutein, and 2 milligrams of zeaxanthin was beneficial at helping to slow down certain stages of macular degeneration. The problem I have with it, 80 milligrams of zinc oxide is too much for a good portion of the population. All right. And we were involved in some post-DNA studies where we take the DNA of our macular degeneration patients and found out a specific subset of these patients with macular degeneration have a specific DNA SNP that 80 milligrams zinc is way too much. And that zinc was actually doing just the opposite, potentially harming them. Okay. And many patients in the AREDS2 study actually had some urinary tract infections, had some other problems related to too much zinc. So the consensus in the nutritional world of ophthalmology and optometry is that you probably need lower, and my consensus is 40 milligrams of zinc or less, and I even like 30. There was 2 branches of the AREDS2 study that had 25 milligrams and 40 milligrams, I think it was, of zinc, and had the same positive benefits without the negative benefits of the 80 milligrams of zinc oxide. So we actually created a formula, Raymond called it Advanced Retina Formula. It used to be called AREDS 2 Plus, but I didn't want to have any legal ramifications using the words AREDS 2. So I changed it to Advanced Retina Formula. We changed the formula and we still have 400 units of vitamin E, but the natural vitamin E, not the synthetic vitamin E. We changed the zinc to zinc monomethathione, a much more absorbable, bioavailable form of zinc, and cut it to 30 milligrams, threw all the copper out. We added resveratrol, which we're going to talk about today, and astaxanthin that has some amazing health benefits that we've learned a lot more about these two nutrients for macular degeneration since the ARED studies. And of course, we put the lutein and zeaxanthin. So we have everything that was in the AREDS 2 study, plus we added the resveratrol and the astaxanthin. We cut the zinc back and did away with the copper. And I've got thousands of patients on this formula, many doing quite well. However, that's not my go-to supplement for my personal macular degeneration patients. You know, it's more cost effective. So if you're on a budget, it's a little bit more cost effective. But I like the Fortify Macular Defense because the Fortify Macular Defense has all the nutrients that were in the AREDS 2 study, not at those same levels, but we also have the B vitamins, the B6, the B12, the folic acid that was in some great studies that we're going to talk about. We have the resveratrol. We have a lot more lutein and zeaxanthin. We have the spinach and the kale and the blueberries and the bilberries. And I'm going to go over this a lot more, but I put that together. I've changed it 14 times in the last 15 years. I'm changing it the 15th time in the next 4 or 5 months based on ongoing research. So remember, there is no cure for macular degeneration, but it is a nutritionally responsive disease. It does not replace your retina specialist or your optometrist or ophthalmologist. But when you combine the right diet, eating the right foods with the right vitamins, all right, in conjunction with the treatments that your eye doctors are doing, it's very powerful synergy and it works quite well. The other thing, the caveat here and the take home for everybody listening, if you have macular degeneration, do not take any vitamins that have beta carotene in them. Beta carotene is a carotenoid that blocks the absorption of other carotenoids in the xanthophyll family. That would be lutein, zeaxanthin, and astaxanthin. And anybody with macular degeneration, we certainly don't want to block those because those go into the eye and actually lower oxidative stress, inflammation, and increase macular pigment density. Beta carotene will block that. And I know firsthand because I was the lead investigator in a pilot study we did called the BLAZE study many years ago. Beta carotene, lutein, alpha carotene, zeaxanthin absorption study proving this. And it wasn't too long after this that everybody started taking their beta carotene out of their vitamins. Also, beta carotene increases your risk of lung cancer if you're a smoker. So, Raymond, I threw a lot at you really quickly. Does that help?
Yeah, so your recommendations for macular degeneration would be Fortify Macular Defense, 3 tablets a day.
Right, 3 tablets a day. And in a perfect world, I would also recommend a good triglyceride form omega-3 fish oil, like our Fortify Super Omega or our Fortify Super Omega-3 Max. That combination works very well. There are some studies out there that have shown that the right form of omega-3, and we're going to talk about this today also, can indeed help slow down macular degeneration. And populations and people that have higher amounts of omega-3 in their body are less likely to develop macular degeneration. Now, remember, omega-3 lowers triglycerides, lowers cholesterol, improves circulation, helps cognitive impairment. So these things are all beneficial for macular degeneration as well.
Does fish oil increase bleeding? For example, I'm on Eliquis, and I do have a problem with excessive bleeding.
Right. So fish oil only if you take really large amounts. So if most of the studies indicate you got to take 5 grams of omega-3, all right, and 5 grams would be, geez, that would be gobs and gobs of these. So the Super Omega 2 pills has 1,600 milligrams. So you'd have to take probably 6 to 8 of those to start thinning out the blood. But what you can do is you take the omega-3, and then your doctor, as they do their routine blood work, they'll determine if there's any potential problems. And remember, my typical patient, Raymond, is 82 years old, has atrial fibrillation, so they're on a blood thinner. Some are on Coumadin, some are on Eliquis and other blood thinners. They have diabetes, so they have leaky microaneurysms in their eye. They have macular degeneration and glaucoma. And I've been doing this, for close to 30 years, and I've seen the benefits of proper nutrition. Now, no doctor is ever going to tell you, if you're on a blood thinner, not to eat fish, okay? They're not going to tell you that. But sometimes they tell you, oh, don't take fish oil because it's going to thin your blood out. Well, everything in moderation, okay? When I tell you to take 2 omega-3s or 1 omega-3, that means don't take 6 or 8, okay?
Okay. All right. Thank you.
All right, Raymond, take care. Good luck with the macular.
Yeah, bye.
All right. You're listening to Ask the Doctors this morning. Dr. Michael Lange and Dr. Richard Hall. We're here to talk about macular degeneration today and sarcopenia. I want to just expand before we go to the next call here. There was a 7-year study with 5,200 people in it that showed that taking B6, B12, and folic acid decreased the chance of getting advanced macular degeneration by 41%. And we don't know for sure, but we think it's because it lowers homocysteine. We do know if you have elevated homocysteine, and so have your homocysteine checked in your blood if you're a macular degeneration patient. And we know elevated homocysteine increases your risk of macular degeneration. Now remember, AREDS 2 study, the AREDS multivitamin does not have any B6, B12, or folic acid in it. So our Fortify Macular Defense does have that. The AREDS 2 study had vitamin C, vitamin E, lutein, zeaxanthin, and zeaxanthin, and we have that in the formula as well. Remember, just dietary folate, all right, folic supplements showed it reduced the risk of macular degeneration progressing to geographic atrophy simply by taking folate, all right? Riboflavin tended to help as well. Then there was a study called the LAST study, lutein antioxidant supplemental trial. A good friend and a colleague of mine, Dr. Richard Stewart, or Stuart Richard, Stuart Richard, did this study, and it was at the VA, and it showed that increasing your lutein content via a supplement decreases glare recovery, increases contrast sensitivity, and increases visual acuity. So lutein and zeaxanthin are very important. We're getting ready to take the next call. Bear with me. Resveratrol, that's from red wine. Pinot Noir in the northern region of the United States, especially Oregon, has the highest amount of resveratrol. Choroidal vascular endothelial cell proliferation. That's a big word. It means CVEC. That causes hypoxic. It causes irregular blood vessel growth, oxygen starvation to the retina. Resveratrol has been shown to be a useful treatment for wet macular degenerations, especially when used in conjunction with anti-VEGF treatment. That's the injections that you're having. So we also know that resveratrol can actually help reduce the damaging deposits of what we call lipofuscin, which is a component of something called A2E or A2F. And this is increasing your risk of macular degeneration. This A2E buildup in your retina, it's a form of lipofuscin. Resveratrol can decrease this damaging effects. Astaxanthin, some new studies that show it might have anti-VEGF effect, but new studies show it reduces the hydrogen peroxide oxidative stress in your retina. So it is very important. The KARMA study is a study in Italy, showed that lutein, zeaxanthin, and astaxanthin reduced the problems from macular degeneration. There's some other studies we're going to talk about, the LAMA study, the NAT2 study in just a minute. And we're going to talk with Dr. Hall in a minute about sarcopenia. But let's go to the phones. We're getting loaded up, and I need a swig of water. Eileen in Ocala, good morning.
Good morning, Dr. Lange. I haven't talked to you in quite a while or listened to your show, But it seems to me some time ago you mentioned vibration plates. Could you touch on that just a little bit? And then I have a question.
Yes, ma'am. And I'm going to let Doc Hall chime in too on that. It's interesting. This morning when I woke up, I got on my Octane. It's a seated recumbent bike, Stairmaster, and a elliptical all in one. I did it for 33 minutes. Then I got on my vibration plate for 10 minutes, and then I got in the steam room for about 20 minutes, and then I had a good breakfast. So that's why I'm so wide-eyed and bushy-tailed this morning. So a vibration plate is a good way for anybody, but especially as we get older. I originally got the vibration plate because my mom and dad I moved them in with me about 4 years ago, and my dad had fallen and broken his back and became, a little bit decrepit, if you will, and he couldn't get the exercise he used to do. So I wanted a way to help improve circulation and reduce his neuropathy and his leg swelling. So I bought the vibration plate, and it worked amazingly well. You stand on this, or you sit down and put your feet on it, and it vibrates, and it causes these micro muscle contractions, and it helps improve circulation to every part of your body. So it's great for people that want exercise or can't exercise. But I do it before I work out and after I work out. And I've been doing it. I drink my post-workout Fortify Fit with my whey protein isolate, shake it up, drink it down, and in about 10 minutes, I get back on the vibration plate. And I think it really helps distribute the protein to every cell in my body. I do that right after working out, and it helps in my recovery. Doc Hall, you're a recovery expert. I want you to chime in because you're also an expert in the vibration plate.
Absolutely. And, I thank you for introducing the vibration plate to me, I guess 4 or 5 years ago.
Right.
And I have one in my own gym. And at first, I'll be honest with you, as any good researcher, has that little bit of a skeptical eye that, I don't know if this is just a gimmick for late night ordering on the TV, or, does this really work? And you and I put it to the test. I'm fully behind what you just said, of all the things that it does. I'm on mine at least once a day, sometimes twice. And I combine that with a sauna, and it makes you feel like $1 million. And that's what you have to do, folks. You have to be proactive. And I love the vibration plates. In fact, we're trying now, and of course, with a supply line and all this stuff, it's kind of held things up. But we're actually trying to bring those into our stores at some point. And we just haven't had that much success with landing them. That's all. And but maybe here in the close future, we're going to have those for sale. But in the meantime, there's some really, really good models out there, and kind of research a little bit too, folks, when you do this, because there's some really high-end models, and they're not much better than the lower-end models. And get one that has the support railing around it. Some of them are just the vibration plate that you can put your feet on, or like that. I have one for my mom. She sits in her chair and puts her feet on there. She doesn't try to stand up on it or anything like that. But if you get one that has the railing around it and stuff. It makes it much nicer. In fact, mine, you hold on to the railing, is checking your blood pressure, my heart rate. It even checks my BMI, my body mass index, and my body fat levels. So you can do all kinds of little tests on it like that, but it's well worth it. And for recovery, it's one of the best things. I know I have a lot of my pro athletes and bodybuilders and like that. They use the vibration plates now for recovery, and they're excellent.
And you had another question, a second part to that.
Just a couple quick things. I have two friends that have vibration plates, and the one friend has the support rails, and my other friend Debbie just got one, and hers doesn't. And she's trying to hang on to the walls. So do they make the support rails separate?
Yes. Buy one with the support rails. I've got one that I got on, like Doc Hall said, some of them are thousands and thousands of dollars. I bought one online on Amazon called Confidence. And let me tell you, I use it every day. My mom uses it every day for 5 years now. And it cost me like $200. And it has support rails. It has little bands so you can work your arms out. It checks your pulse, all right? It has a variety of different settings. And the one I bought is called Confidence. I don't get any money for this, but it works and it's very cost effective. And you got to get the one with the rails. Otherwise, you just got to sit down or you might fall and hurt yourself.
Yeah, could my friend, since she doesn't have the rails, she's concerned about her balance. So could she sit in a chair
Yes.
with her feet on it?
Absolutely. Yeah, put a chair and just put her legs up on it, and she'll get a good lower extremity workout, and it helps circulation, help her calves, and all. Absolutely.
And that'll also help her balance.
Yes, it will. It will.
Yeah.
Yes.
Okay. All right. Well, one more thing. Do you think it would help sciatica?
Absolutely. I know it will. You know, I've had sciatica, and I'll give you my cure. The vibration plate twice a day for 10 minutes. All right. Laying flat on your back on a hard surface and stretching, getting in a hot tub with Epsom salt for 30 to 45 minutes. All right. Our Fortify Super Omega, our Focus, and our black currant seed oil. It's packaged together in something we call advanced dry eye therapy. Advanced dry eye therapy helps improve circulation and helps reduce inflammation. So advanced dry eye therapy, we created it for dry eye because it lowers inflammation in the eye, but it helped my sciatica. And then also deep tissue massage with a massage therapist that understands sciatica. And then when you're driving your car, take a tennis ball and put it at your lower back right in that sciatic nerve, and that will help reduce pain. If you do all those combinations, it will help.
Okay. Thank you so much. Appreciate it.
All right. You take care.
Bye-bye.
Bye-bye. All right. You're listening to Ask the Doctor as we're getting ready to take the next call. If you've got a question, 1-877-969-8600. We're on a roll. It's the new year, 2022. Everybody should be in full swing with their New Year's resolutions. Get in better shape, become a lean, mean, fighting machine. Eat the right foods, take the right supplements, get a right amount of sleep, hydrate, a little bit of sunshine for the vitamin D. Now, as a little caveat here, if you have an autoimmune disease like lupus, you don't want to go out in the sun a lot. If you're an albino, you don't want to go out in the sun a lot. If you're on any medication that causes you to be super light sensitive, and there are other people that shouldn't be out in the sun a lot. However, the lion's share of you can go out and get a half hour of sun a day without sunscreen, and you'll be fine. And the other of you have to be taking a vitamin D supplement. We do at Fortify now have a vitamin D gummy. It's delicious. It has 6 organic fruits in with it. It's a gummy, and you can get 1,000 units with one. Eat 2, you get 2,000 units of vitamin D. And we do have vitamin D now in a supplement through Fortify Vitamins at fortify.com or any of our nutrition centers. All right, we're going back to the phones. Let's see. Deborah is on hold. Deborah, thanks for holding. Good morning.
Good morning. How are you?
Fabulous.
Okay, well, I have a kind of a offbeat question. Of course, it's Saturday and everybody's closed. I had cataract surgery last year. I had a laser surfacing done about a month ago. And my left eye is completely red and the eyelid is swollen. It doesn't seem to be anything wrong with the eyeball. Nothing actually, like the tear duct, everything matches my other eye. Everything's symmetric. But I'm losing a lot of liquid out of that, kind of a mucus.
Mm-hmm.
And I have, for my surfacing, I was given, if I say this right, prednisolone acetate.
Mm-hmm.
If I said that correctly. And I think that it was an antibiotic or steroid, something to help prevent infection after the resurfacing.
Right.
I was just wondering whether that might hurt if I tried that now, because of course everybody's closed on Saturdays to go in and see this.
Right.
And I don't know if a hospital could help me with my eye.
So if you lived on a desolate island and you were the only person on there, you had a red irritated eye, okay, and there was nobody around, I would say, yeah, it was worth trying the prednisolone acetate. However, you're not on a desolate island. There are doctors open on Saturday that you can see, and you could have something that would be contraindicated to putting a steroid. Prednisolone acetate is a corticosteroid. It's not an antibiotic. If you have a bacterial infection, it can make it worse. If you have an allergy, it'll make it better. If you have most types of viruses, it can make it better. But if you have certain types of viruses, that have the herpes name to it, a herpetic type of virus. And it doesn't mean, genital herpes. I mean, herpes can be from, chicken pox. It could be herpes shingles. It could be zoster. Then that steroid can make it very worse very quickly. If you have an ulcer, it's a bacterial ulcer, it can make it worse. So that's why I don't want you to treat with a steroid unless you see an eye doctor, okay? There are many doctors that
Okay.
are open today. You might have to go to one of the commercial chains, but there are many optometrists you can see today. And if you have a red irritated eye, that's what you really need to do. I mean, if you want to come by and see me at the Fortify Nutrition Center today from 12:30, I can take a look at you and see if I think you need to even be seen by a doctor, and make some recommendations. But if you want to know, you really got to get in to see an eye doctor so they can look at you with the microscope. Okay?
Yeah, is an optometrist okay, or do I have to find an
No,
ophthalmologist?
no, absolutely. An optometrist can treat any disease and prescribe any medication. So you're fine going in and seeing an optometrist. Okay?
Okay, terrific. Thank you.
All right. Take care. Bye bye.
Bye bye.
All right, we're really getting loaded up here. I want everybody to remember we're talking about macular degeneration today and sarcopenia. We're going to get to sarcopenia in just a minute. But macular degeneration, we talked about Fortify Macular Defense, and we talked a little bit about Fortify Advanced Retina Formula. So, Fortify Advanced Retina Formula is a great formula based on a lot of good studies. It's a little more cost effective. It's probably $30 versus $55 for the macular defense. But the macular defense is kind of the Bentley or Rolls Royce, if you will, of macular degeneration supplements that I have created. And you can learn more at fortify.com, Fortifeye, fortify.com. Then I've taken the Super Omega, the Fortify Macular Defense, and Fortify Focus, which gives you additional lutein and zeaxanthin and 6 milligrams of astaxanthin, and put it together in a bundle. If you want the ultimate, in my personal opinion, and I've got hundreds, if not thousands of people taking it, it's the Macular Defense Bundle. Go under bundle on Fortify Vitamins, and you get all three of those. Those would be about $150 with shipping for $99, and that includes shipping. So it's the Fortify Macular Degeneration Bundle. Look at it at fortify.com. All right, I think the next caller is Deborah. Deborah, good morning.
Good morning, everyone. Yes, Dr. Lange and Dr. Hall. Question of the day, real quick. With the Lange Institute diet, do you happen to have all the foods and everything in a PDF format, like a checklist? So if I took the piece of paper and went grocery shopping, I can check things off as I go.
Well,
to make it really convenient.
Yeah, the simplest thing is go to just Google Lange Survival Diet, okay? Google Lange Survival Diet. And then the first one that pops up is on my website, drmichaellange.com. A lot of them pop up on different websites, but that's the most updated one. So Google Lange Survival Diet, and then the one that pops up under drmichaellange.com, just highlight that on your computer, highlight that diet, and press print, okay? And then it tells you exactly what you need, all right? And if you can't do that, then you can call Arlene. Arlene can print it for you and have it at the Nutrition Center. She can mail it to you. She can email it to you. So that's simple enough. But I agree. If you have that list with you when you go into the store, then you just buy those foods, and that's all you buy. And if that's all you have in your house, that's all you can eat. You are going to become healthier, less bloated, better circulation. You're going to get down to your ideal body weight.
Correct. All right. Thank you so much for your time, and have an awesome day.
All right. Take care. And the next caller is Mark in St. Pete. Mark, thanks for holding. Good morning.
Hey, good morning. I have a couple of questions. One regarding supplements. I use your supplements. I recently purchased some of your CD Zinc. In addition to, I take the complete omega-3 Max and Fortified.
Mm-hmm.
And I wanted to check, am I getting too much vitamin D taking both of those daily?
Nope. How much do you weigh?
200.
Yep. So you're absolutely not. I mean, I always say everybody needs at least 2,000 units of vitamin D3, okay? But many people can get away at 200 pounds. You could get away with 5,000 units, all right? But I don't recommend 5,000 units unless recommended by your physician. There are people out there taking 10,000 units. That's too much, in my opinion, okay? Do you get much sunshine?
Maybe on the weekdays, 15 minutes, half hour a day.
Yeah, so you're probably at the ideal levels, especially during these crazy times. Remember, vitamin D helps your immune system dramatically. And so you're getting in the Fortify Complete, you said, right?
Yes.
And the one in the CD zinc. Yeah, that's less than 4,000 units. So yeah, you're at a perfect level.
And the zinc also between those two comes in at 42 milligrams. So that's at your level 2 that you recommend.
Yep.
Correct? That's not too much.
42 is fine, especially right now. It's fine. Anything above, really above 50, you got to add a little copper. All right. But 40 milligrams, right around 40 milligrams is ideal. So 42 is perfect.
Perfect.
Yep.
Yeah, I love the supplements. One other question, if I may.
Mhm.
Recently had my annual eye exam, and my doctor diagnosed me with dry eyes. He recommended the warm, moist heat, like you recommend.
Mhm.
And he also recommended an eye drop with mineral oil. And I have always seen most of them, correct me if I'm wrong, contain glycerin as a lubricant.
Mhm.
And I actually ended up buying one he recommended called Soothe,
Mhm.
which has the mineral oil. Can you go over mineral oil versus glycerin as a lubricant?
Yeah, so the mineral oil is not bad, all right? Mineral oil can sometimes cause your vision to be a little blurry for just a short period of time, but it acts as a lubricant and it's not bad. I don't love the mineral oil ones as much as the ones with glycerin. I like it if it has hyaluronic acid in it or sodium hyaluron because that acts as a natural type of anti-inflammatory. So if it has mineral oil with hyaluronic acid, I think that's fine. But if it has glycerin with hyaluronic acid, that's probably fine too. The main thing to look is if it has sodium hyaluron or hyaluronic acid in it. Keep doing the hot compresses, drink your water, take your omega-3. The two that I like the best are Optase and Oasis Tears Plus. Optase and Oasis Tears Plus.
Perfect. Well, as always, thank you so much for your time and information.
All right. Take care. And we're getting ready to talk to Dr. Hall about sarcopenia, but I just want to finish really quick the segment on macular degeneration. The Llama 1 and 2 studies, they might even a Llama 3 study, used Lutamax 2020. That's a combination of lutein and zeaxanthin isomers. Zeaxanthin isomers has actually some mesozeaxanthin in it as well. The study showed that this increased macular pigment density, increased contrast sensitivity, and decrease the photostress recovery time. So this type of lutein has been studied, backed by clinical studies. I recommend it to my macular degeneration patients. Lutamax 2020 is what is in our Fortify Macular Defense and in our other macular degeneration vitamins and in our Fortify Focus. Now, there's a good study called the NAT2 study, and it showed, and the Euro Eye study, it showed that people that had high EPA and DHA, so that's the omega-3 that's in our Super Omega and our Super Omega Max, significantly less chances of developing wet macular degeneration. It was like a 58% reduction. So the NAT2 study, the Euro Eye study, all showed this. One of these was an Australian study, and the Australian study showed that it was a 50% reduction, and the other study was a 58% reduction in advancing macular degeneration by taking omega-3. All right, sarcopenia is muscle wasting. Many of us are losing muscle mass as we get older. Doc Hall, let's chime in on that, okay, my friend?
Absolutely. First, I'd like to just make a little comment on our callers' questions today. Fantastic, and folks, you always make our show better with your calls and your questions. So thank you very much for that today. I've been involved in sarcopenia research for about 25 years, and my colleague Dr. Lange as well. Sarcopenia can be seen as a loss in muscle mass, and also in strength and in muscle function. It actually begins as a process of the body at age 30. Most people think, well, it begins in your 50s, 60s, and 70s. And that actually begins in age 30. And you can lose between 3 to 5% of your muscle mass strength each decade. Okay, so over 30 years, you can lose 15% of your muscle mass, and I've seen it a lot higher. Now, due to my research, I've been outspoken about sarcopenia, and many people know that. For years, sarcopenia has been looked on as inevitable. It's going to happen. Nothing you can do about it. Well, I'm here to say, yes, you can. You can do a lot about it. My approach is sarcopenia is not so much of an age-related condition as it is a lifestyle condition, okay? We all know our life changes as we go along. As we march down the road, our life changes, okay? Maybe you're not as active as you once were. Maybe you're not, up on your nutrients and your protein as you once were. These factors can greatly increase sarcopenia. Now, there is not an approved FDA medication for sarcopenia, so you need to be proactive with this on your own, okay? There's no magic pill out there. Never was, probably never will be. It's important because we can't afford muscle loss. We need it for strength and stability and to avoid those falls and injuries. Okay, that's important. Okay, there are special exercise classes to build strength and stability. Resistance and light weight training will certainly help. The big nutrition factor is protein, folks. Protein is the building block of muscle. And sometimes we're way behind in consuming enough protein. And the latest research also shows that creatine, vitamin D, omega-3, branched-chain amino acids, and collagen, plus whey protein and glutamine are all positives to fight sarcopenia. Our special formula of FIT has creatine, branched-chain amino acids, and collagen, and they're all in clinical dosages, okay? Our whey protein, too, by the way, is ideal for building fighting sarcopenia. I hear the music starting, Dr. Lange, so I'm going to say goodbye, and we'll see you next hour or next week.
Thank you, Dr. Hall. And as Dr. Hall mentioned, sarcopenia is in full swing. A little exercise, our Fortify Fit, combined with one of our whey proteins, will potentially benefit you. So get off your keister, start exercising, taking the right supplements, all right? Check it out at fortify.com. Thanks for tuning in and listening to Ask the Doctors. I'm out of here. Have a great day. God bless you. God bless America.
Ask the Doctor with Michael Lange begins in 8 minutes. Ask the Doctor with Michael Lange begins in 7 minutes. Ask the Doctor with Michael Lange begins in 6 minutes.